Welcome to this Asia Pacific Road Safety Observatory Bower and Bag presentation on the estimating the benefits from road safety investment. My name is David Shelton. I lead the observatory for the Asia Pacific Road Safety Observatory, and I'm the road safety focal here in the STCC Transport Sector Group. Our format for today, we will hear from our presenter and then take discussion and questions from there. So please use the chat box as we go to record questions as they come up. And otherwise, please keep your microphones muted until we get to the Q&A. Okay, we are currently in the United Nations' second decade of action for road safety. The agreed target for this decade is to halve death and injury from road traffic crashes between 2021 and 2030. The latest estimates have those figures at about 1.3 million deaths every year, with the majority occurring here in Asia and the Pacific. The International Road Assessment Program, or iRAP, has published a new Safety Insights Explorer to help us understand the true scale of costs of road trauma and to see what investment is needed in order to address these. It's a freely available resource, and today we are going to have a look at what's in the tool and how it can be used. I welcome Greg Smith from iRAP to the podium to walk us through. Greg is the Global Program Director at iRAP. iRAP is a charity organisation based in the UK, aims to prevent serious road crashes as the leading cause of death for young people worldwide. Greg works closely in partnership with government and other leaders right across the world, and particularly through the multilateral development banks. He's a strong advocate for engineering interventions to make roads safe and has been a key developer and promoter of the iRAP tools for many years now. There are a suite of iRAP tools, and I encourage you to have a look through their website. Today we are looking just at one of those. Greg himself has more than 15 years experience in international road safety. He's currently based in Hanoi in Vietnam. Welcome to you, Greg.
Hi, Dave. Hi, everyone. Thanks very much for having me.
Greg, I will leave it to you to present from your end to walk us through, and we will take questions towards the end.
Okay, no problem. So let me share my screen here. I'll start up the slides. And maybe, Dave, you just confirm when you can see that?
Yep, it's looking good.
Great. Okay, well, firstly, thank you, everyone, for taking the time to join today. Like Dave said, I'm going to give you a presentation on our new iRAP Safety Insights Explorer. I'll give you a little bit of context about where that's come from, what we think it can be used for, and show you how to use the tool as well. Like Dave said, iRAP is the International Road Assessment Program. We're a charity with our main focus is helping countries create a world free of high-risk roads. The tools and the methodology that we've created have kind of become a global standard for road infrastructure safety assessments worldwide. And as I said, we provide tools, training, communications, advocacy to support large-scale action on safety. A really important point that I want to emphasize is that methodology and the tools are free to use right around the world. You can find out a little bit more about iRAP and our strategy for the decade of action for road safety by following that link over there on the right-hand side. You'll see that it emphasizes the role of partners in this. It's something that we've very much taken to heart, is the important role that our partners play in making use of the tools to improve road safety. It's certainly one of these areas that no single organization can tackle alone. It needs everyone to work together to make the changes that are necessary. Of course, we've had a very long and fruitful partnership with the Asian Development Bank over many years. We've been an MOU partner with ADB for, I'm not going to guess how many years, but quite a long time now. And we're very thankful for the opportunity to work with you all. So iRAP is best known for the star ratings that can be produced using the methodology. It's a simple and objective measure of the level of safety which is built into the road. The star ratings themselves are obviously quite simple, but what underlies the methodology is actually quite sophisticated and quite detailed. The star rating assessments can be completed worldwide in urban or rural areas, and importantly, without reference to detailed crash data, which, as you'll know from your experience, is often not available in many contexts. So the least safe roads are the ones that get the 1-star rating, and the safest are the ones with the 5-star rating. The key point is that you can get different star ratings for different road user types. So for vehicle occupants, motorcyclists, pedestrians, and bicyclists. And I'll talk a little bit more about the implications of that when I show you the tool in a few moments. We've also got quite a lot of experience now helping to understand the impacts of changes to the star ratings of roads. And generally speaking, we know that moving a road from 1-star to 2-star has a really significant impact on the cost of trauma on that road, and so forth from 2 to 3, 3 to 4, and 4 to 5. Generally speaking, you can see a halving of the cost of trauma per kilometre travelled on each of those roads as you increasingly move from 1 to 2 to 3 to 4 and 5-star roads. You may have seen, and I'll talk in a moment about the global targets for trying to get roads to at least 3 stars or better. And that chart on the right helps to underpin and I guess explain what or some of the basis for setting that target. We know that once you get a road to 3 stars or better, you've had a really dramatic improvement in terms of trauma costs compared to a 2-star or 1-star road. Just in terms of the scope of, I guess, the work that we do globally, as I said, we very much depend on our partners in achieving road safety gains. And we're very fortunate to have seen the tools used in more than 100 countries worldwide. The tools have been used in infrastructure projects with a total value of more than $95 billion worldwide. And of course, many of those dollars are from ADB projects, for loans that your member countries have taken out to improve their roads. There's more than 2 million kilometres of roads worldwide that are either being star rated or where there's crash data available have been crash risk mapped. And as you'll see, there's lots more statistics about our partnerships around the world. Very interestingly, a piece of research that we've had done with Johns Hopkins University that's still preliminary, but hasn't been published yet, but will be soon, estimates that projects that have used the iRAP methodology over the years have contributed about 400,000 savings in deaths and injuries by 2022. So really significant number of life-saving and injury-preventing interventions that have happened. And that's not just because of the iRAP assessment. In the end, the iRAP tools are just a tool. It's really because of the willingness of governments and development banks like yours to make conscious efforts to improve the safety of the designs that are being built. The good thing about infrastructure is that it keeps saving lives long into the future once it's built. We know that a well-designed, good pedestrian crossing, for example, can save a life today, it can save a life tomorrow, and can keep saving lives long into the future while ever it's maintained. So that number, that 400,000 deaths and injuries prevented, we're going to see continue to go up. Even if nothing else is done right now, that will continue to increase as lives are saved because of that good infrastructure. 400,000 seems like a big number, but we know there's 1.3 million deaths happening every year. So it's not quite big enough yet. We want to do much more. And obviously our partnership with you at the Asian Development Bank is really central to our efforts to making impact across Asia. So let me get into this new tool, which is the Safety Insight. So the purpose of it really is to help shine a light on the true scale of road crashes. We know that although there's a lot of road safety discussion happening these days, people still haven't sort of taken on board the true extent of the social, health, and economic impact of crashes. But also we want to expose, or I guess share, more of the iRAP assessment data that's been done worldwide, but also help contribute to the discussion about what sort of investment, what level of investment can be justified for safety. So the bit that I'm going to be talking about is a new section on our website called the Safety Insights. So the picture on the right-hand side shows where you can find all the information that I'm going to be talking about here. So that's a snapshot of our homepage at irap.org. So you can easily jump on there now and follow along with this content. The Safety Insights Explorer, it's just one of the tools in that menu that you can see there. It was developed with the Transport Accident Commission in Australia and the FIA Foundation. The Transport Accident Commission is the compulsory third-party insurer in Victoria in Australia, and they have a monopoly on the insurance claims management for every road crash that happens in that state. They're a government-owned private entity, and their vision is really also to improve road safety through management of the insurance program. So they've been very, very open with sharing some of their key statistics, which has underpinned some of the estimates that we've made about the types of injuries that are occurring worldwide. So just to drill down a little bit more on that menu on the website, the Safety Insights, you can see there's five different topics. There's, are our roads 3 stars or better? There's information about the global road safety toll. There's a human toll, information about investing for impact, and the Safety Insights Explorer itself. These 4 topics each give context to the actual tool that I'm going to illustrate a little soon. But those pages actually have some really interesting information on them themselves. It has some little graphics that help to show you how the world's roads rate in terms of safety, and particularly in terms of key performance indicators such as safety for pedestrians walking along the road and crossing the road. There's also real stories of the impact of road trauma, so a whole series of videos that are available about victims of real road crashes that focus on different types of injuries that have occurred. They can be incredibly powerful for helping to, I guess, orientate people about the impacts of road crashes when you're having discussions with them about investing in safety. You can also find quite a lot of information, for example, about which governments have adopted strategies or action plans or policies that line up with the global plan for the Decade of Action and or have star ratings in them. That can be really, really helpful when you're having a discussion, for example, with a country, a member country, about investing in safety, and you get the chance to really refer to their national action plan and put your proposals into the context of the national plan. There's also case studies there and more information about the iRAP star rating certification scheme. So just getting right into the Safety Insights Explorer tool itself. So it's an interactive tool. We've put it into a Power BI interface, so it's very easy to use and very accessible. As I said, it draws on data from the Transport Accident Commission, but also from the World Health Organization, World Bank, Global Health Data Exchange, and the IMF. And we draw on all those sources to make many of the estimates that I'll share with you. So we've made estimates of the numbers and types of injuries that are occurring in every country by age and sex. That point about the types of injuries that are occurring for every country is something that just hasn't been done before. That data does not exist on a global level, and in many countries that data doesn't exist, or even at particular district or provincial levels. So they're genuine estimates, but they help to, I guess, calibrate your discussions and understand the type of impact that crashes are having. We've also expanded the amount of star rating and key design attribute data that's available in the tool and on our website. So there's sample of data of more than 500,000 kilometers of roads across 84 countries. So you can use that data to check out what the status of those assessments and those indicators are for particular countries. You can compare them with other countries and help get a sense of where that country is at in terms of its development. We've also got business cases for investing in safer roads. So we've done analysis to say, okay, if a country wants to try and comply with the Global Road Safety Performance Target number 4, which is to say that most travel occurs on roads rated 3 stars or better, how much would that cost and what would be the benefits of doing that? So I'm going to jump into the tool right now and give you a little demonstration of how it works. So I'll jump out of this screen here and jump in here. So perhaps Dave, if you can just give me a thumbs up that you can see the web page. Great. So what you're looking at here is the iRAP web page, so irap.org. And here's the menu that I was talking about in that slide earlier with each of these different items here. So the page that we're looking at right here is the one that's called the Safety Insights Explorer. When you load it up, it's going to bring up this screen here, which is the Power BI tool embedded in the page. And I'm going to open it in full screen mode so that you can see it here. So across the top of the tool, you can see 5 buttons. One is human impact, one is star ratings, one is KPIs, key performance indicators, one is business case, and one is about. So the about page includes all the information about, I guess, the methodology about what we've done to produce many of these statistics. So you can see discussion on how we did the human impact tab, and particularly how we did the business case for safer roads methodology as well. But yeah, very happy to discuss that a little when the question and answer session opens. So I'm just going back to the human impact section here. What you can see on the left-hand side is a series of filters: country, WHO region, income level, so whether a country is high income, medium income, low income, age groups. These are age groups based on the UNICEF definitions and categories, and sex for male and female. And down the bottom, you can see how many countries are selected. So there's 175 countries on the screen at the moment, in the data on the screen at the moment. On the main screen, what you can see is a list of casualty types, so fatalities at the top, and then different injury types that often road crash victims get categorized into. These are the injury types that are recorded in the Transport Accident Commission insurance database. So begin with severe acquired brain injury, mild or normal head injury and brain injury, fractures, internal injuries, quadriplegia, paraplegia, and so forth. In the data side, there's 2 columns. One is estimated road crash casualties, so how many of each one of those are estimated to occur, and the estimated cost, the economic cost of each one of those as well. So you can see the shape of the estimated cost is quite a nice curve. That's because we've sorted this list of injuries according to the cost column. So what you can see is, according to the WHO, there's 1.32 million deaths that occur on the world's roads each year. And we've estimated the economic cost of that is $632 billion every year. Really interesting thing about this is that while many people may have sort of tuned into the numbers of deaths that happen in the world's roads, the numbers of injuries is actually far, far greater, much greater. In total, we've estimated that there's 37 million casualties happening each year. So that's made up of these numbers that are underneath the fatalities. So you can see 450,000 severe acquired brain injuries happening each year, 7.2 million fractures, 6.6 million contusions or abrasions, 32,000 quadriplegias, 45,000 paraplegias. So these are the types of injuries that are happening as a result of road crashes every year worldwide. And I guess the first number, or first stat to really take on is that the fatalities that are happening are really the tip of the iceberg. Actually, the level of trauma and impact on communities and society goes way beyond the fatalities that happen. The injuries often leave long-lasting, life-changing impacts. The costs also are the same story. So we estimate that fatalities cost about $632 billion every year, but the total cost, including the casualties, the injuries, is about $2.2 trillion. So that, I guess, gives you a sense of the sorts of investment that might be justified in terms of trying to treat this problem. At the moment, we are certainly not investing $2.2 trillion in trying to tackle this annual cost. Another interesting thing that you get from this is you can see that although for example, the severe acquired brain injury is much less in terms of numbers than the fatalities. The cost is about 2/3 of that. And that's because actually from the experience with the Transport Accident Commission, who obviously is the insurance organisation that covers the cost of trauma, treating someone with that type of injury, which can last for many, many years, is extremely expensive. In a high-income country, it's extremely expensive because of the medical care. In a low-income country, the cost also is extremely expensive, but the medical care might not be the same. What you might see in a low-income country, for example, is the impact of that injury is actually borne by the family and the local community looking after that person. And so in many ways, you see similar sorts of costs, but the nature of the costs being dealt with in different countries in different ways. What you can also see on this chart is a little button up here that gives you the daily and annual number. So you can click on the daily and also get the daily estimates, which are in some ways more shocking than the annual. So we know that 3,600 deaths happen every day. That's $1.7 billion in costs every day. But then there's 1,200 people every day suffering severe brain injuries. If I just click back to the annual, obviously we can do these searches now for every one of these filters as well. So for example, if we take a look at Bangladesh, we can see an estimate of 24,000 deaths happening every year, but 9,400 severe brain injuries happening every year, 176,000 fractures happening every year. And in a place like Bangladesh, like a fracture can be an incredibly, I guess, traumatic experience. Like a broken arm in Australia, for example, could be fully treated within months with good immediate medical care and good rehabilitation. But that same broken arm in Bangladesh could mean a lifelong experience of pain, much less productive at work, and never really fully healing from that injury. So these sorts of costs, that cost we've attempted to capture, and those impacts that we've attempted to capture through these costs. So in Bangladesh, for example, $8.9 billion in terms of costs every single year. We can also do these filters, of course, for the different age groups. So if I do the 0 to 19 age group, which is the definition that UNICEF uses for young people, we can see, again, really large numbers, 200,000 people, young people in Bangladesh suffering casualties every single year. Really interesting thing here too is that brain injury are actually a higher cost than the fatalities in that case. And that's because a young person with a brain injury could live for decades thereafter and requires enormous amount of care to survive through that period. So you do see in the pattern, I guess, as you look at different age groups and the different sexes and the different countries, different patterns appear in the estimates. So that's the human impact part of the tool. And I think it can be really valuable for helping have discussions about the scale of the problem and also the sort of benefits that might be drawn by investing in safety. I'm just going to jump now to the KPIs tab. I'm going to skip over the star ratings for now, but we can come back to that. The reason I'm going to skip over the star ratings is because they're sort of repeated in a way in the KPIs tab. There we go, just coming through now. So I'm going to reset it all back to all countries. So what you can see here is this is the data that's based on the actual iRAP assessment that has happened across more than 500,000 kilometers of roads in 84 countries. Across the top, you can see the percentage of roads that's rated 3 stars or better for pedestrians, bicyclists, motorcyclists, and vehicle occupants. Then underneath, you can see KPIs. These are some of the key combinations of road attributes data that feed into the star ratings and which we know have an impact on safety performance. So for example, the percentage of road where traffic travels at 40 kilometers an hour, where there's pedestrians present, and where there is a formal sidewalk is 7%. So of all the roads that we've looked across the world, wherever speeds are greater than 40 and there's pedestrians present, only 7% of those cases have a formal sidewalk in place. If I jump over here, pedestrian crossings in good condition, 63% of the pedestrian crossings that have been seen in these assessments are in good condition. So probably pretty reasonable number and high number compared to some of the others, but still lots of improvement, room for improvement. Roads that have 60 kilometers an hour and lots of motorcycles that have motorcyclist facilities, basically non-existent on a global scale. But we know that motorcycles are increasingly becoming the norm for many countries in terms of travel. Intersections with protected turn facilities, so that's either a turn lane or at a roundabout, where traffic travels at 60 kilometers an hour or more, is only 29%. So 1 in 3 intersections tick that box. So all of these data help to paint a picture of the level of provision that's built into the road network for safety. And we know that turning any one of these dials has a big impact on safety. So what it says to you and to analysts is to say, okay, what if we just were able to lift this 7% for pedestrians and sidewalks up to 10 or 15 or 20%? We know we're not going to make it 100% overnight, but any sort of improvement, measurable improvement, is going to have a measurable improvement on safety. And again, we can filter these for any country wherever there's been iRAP assessment done. So let's take a look at Vietnam, where I am at the moment. One of the things you can notice when you do that is the little blue lines on each of the charts perhaps becomes a little bit more apparent when you make the move. So that blue line is where the global average is. So you can immediately say, okay, Vietnam, based on the roads that we've looked at, 10% are 3 stars or better, which is below the global number that we've seen. Bit better for bicyclists, better for motorcyclists, and better for vehicle occupants as well. And again, a mix across the different road attributes. Really interesting, you can see that there's 9.1% of the roads that have been assessed in Vietnam have motorcycle facilities. It's not so surprising, kind of the home of the motorcycle travel in many ways, but they have been at the forefront of building facilities specifically for motorcyclists. And if I filter again for urban areas, these are looking at about 800 kilometers of urban assessments that have been done in Vietnam to date. You can see that number jumps really high. It's up to 77.5%. Of course, this is not a sample of all urban roads in Vietnam, so it's can be a little biased based on the roads that have been selected by the country for assessment, but nonetheless gives you a really good indication of where they might be at. One of the key patterns you see when you look across all the data is this pattern here, where vehicle occupant star ratings are always better than the star ratings for the vulnerable road users. And that's a historical sort of legacy that we've had about how we built roads. We've very much focused on vehicle occupants, and the vulnerable road users have been sort of a secondary, third, or if not considered at all. And that comes through in the statistics as well. So again, these filters enable you to explore this data in quite a lot of depth. You can look at vehicle flow categories, high flow or low flow roads. You can look at different carriageway types, whether roads are undivided, divided, or specifically at motorcycle facilities. And also, as Dave mentioned, he leads the Asia Pacific Road Safety Observatory. We can filter for the observatory countries as well. So that data is all freely available and hopefully can be valuable as a reference point for your discussions with countries, but also in setting targets for projects as well. The last tab that I just wanted to share with you is the business case. So it's a little bit about the so what can we do? So within the global plan for the Decade of Action, there's 12 performance targets that have been agreed by the UN. Target number 4 says we should try and get 75% of travel happening in every country on roads that are safe for all road users. And one of the ways you can measure safe is to say it's 3 stars or better. So what this screen does is say, okay, what's the current situation in a place? What would I need to invest in order to get to that 3 stars or better? And what would be the impact in terms of lives saved and injuries prevented? So this is the global case that we're looking at right now. It's a little bit too much to digest in one go. So perhaps I'll zoom into a particular country in this region. Let's say India. This is the major country in the region in terms of population. So the current situation is an estimated about 300,000 fatalities happening every year And in terms of fatalities and serious injuries, about 3.2 million fatalities and serious injuries every year. The annual cost of that is estimated at $129 billion, so about 5 to 6%, or the equivalent of 5 to 6% of GDP. The investment required is about $90 billion to get the road network up to a performance where it's 3 stars or better. And it's important to note that that investment doesn't necessarily have to be new investment in road safety. In many cases, in the vast majority, it's about taking the investment that's already happening and tweaking it to make it safe. We've seen many cases in India where investments where like the budget has been increased by less than 5% has made really dramatic improvements to the safety performance of the road. And we've seen that with well-banked demonstration corridors quite often. The impact would be, of course, really large. There would be more than 100,000 fatalities saved as a result of that every year. And then more than 22 million over 20 years, 22 million fatalities and serious injuries prevented over 20 years. The economic benefit is much, much larger than the economic cost, the cost of investment. So about $800 billion with a benefit cost ratio of 8.7. So what this does is, I guess, help to elaborate the discussion about what to do and what scale of investment is necessary to achieve the global road safety performance target. And it can be really valuable in, I guess, calibrating people's understanding about the level of investment that's needed, that can be justified. And of course, the important role that every individual project that happens that can contribute to stacking up to make this overall large investment, this large impact. And again, you can make these queries by any one of the countries all around the world. So I might just grab another one. Let's grab one of the Pacific Islands, like Fiji. So in Fiji, for example, an investment of $111 million would result in about 6,325 deaths and serious injuries being prevented over 20 years. Like I said, that 110 million doesn't necessarily have to be new investment. Making sure the investment that's happening is really safe could really significantly improve that. Another point that's not really captured here, though, is I guess bearing in mind that we know from experience that most deaths in a country happen on a relatively small proportion of the network. About 75% of travel, for example, is likely from our experience to be happening on about 5 to 10% of roads in a country. So that what that really tells us is that focusing in on a relatively small proportion of really significant and strategic roads is the best way to make a big impact on safety at a national level. So I might leave it at that for now, Dave. That's a whirlwind tour of the tool and how it can be used, but very happy to have questions or discussions about it.
Terrific. Thank you very much, Greg. I'm opening up to questions at this point. So if you do have a question, please either raise your hand or pop it into the chat. I'm going to ask a couple of questions just to warm things up. So so let's get started. I notice, Greg, at the moment, the investment business case part of the tool is specifically designed for the case to reach target number 4. Am I correct there? And can it be modified to illustrate what would be the costs and benefits of reaching other targets, such as the 50% reduction?
Yeah, absolutely. Yeah, no, that's all. It's all sort of a modeling exercise. So absolutely, we could adjust that. What we have now is, because of the really large iRAP data set, each one of those also have an economic analysis attached with them. The star ratings is just one of the assessments that happens, but we often do a safer roads investment plan and different iterations of that. So we can draw on that data to help model these impacts. So absolutely, and like with every modeling exercise, there's a lot of assumptions that underpin that, and that's something that we'd need to discuss with you and calibrate those assumptions well. But sure, that modeling can be done.
Now, if we're talking about a country reaching a 50% reduction, say by 2030, and we've got a sense of how many deaths we're trying to prevent, of course, infrastructure is not the only tool that we have to play with, and different pillars in the safe system have effect over different time periods and at different cost. Have you got a sense of how much of the reduction a country might be looking at to achieve through safe infrastructure versus, say, safer vehicles or safer road use over, over that sort of period of time, over 10 years?
Yeah, I think different countries have different experience with this, but I like, if I'm going to have a stab at it, I would say 30 to 50% of the reduction could come from infrastructure. Typically, I think that's been some of the experience of the developed countries. But we have definitely seen demonstration projects where the reduction in deaths is 50% or more. And definitely in some of the projects that we've seen very recently in Tanzania, for example, with their bus rapid transit corridor, estimated reductions of more than 60, 70% as well. So like the opportunity to make really large impacts at the project level with infrastructure is there, and then it's a matter of stacking those up across those strategically important roads to make a big impact. But I guess you mentioned the different timeframes of these, and I think like infrastructure takes a while to kick in. It takes a while, like years, to plan and be implemented. Good enforcement, if it happens, can have a really immediate effect. Like the moment you're doing enforcement, it's going to have a saving right away. Sustaining that is a really, really challenging aspect, in the same way that maintaining a road in good condition is a really challenging aspect as well. So we've generally found, like working with the developing countries, that the infrastructure is something that's very actionable, especially with the development bank projects. There's already roads being built, so it's a matter of adjusting those. Working with the police can be quite challenging. It's this element of sort of the difference between infrastructure changes and human behavior changes is the nature of it is quite different. I think vehicle safety standards play like a really, really important role. And that's probably one that it's a bit overlooked still. Like I hop in cabs all the time that don't have working seatbelts. And if every car had a working seatbelt and everyone wore them, immediately there would be a reduction in trauma in every country. So yeah, I think that, yeah, I would say, I'm going to say 30 to 50% of can come from infrastructure, and it's very actionable for the most part.
It sounds like a good estimate to me. I did a review of New Zealand's action plan a few years ago, and they had set themselves a target of 40% to come from infrastructure over a 10-year period. Another question for you. Many of our project officers and our DMCs are very familiar with road safety audit and somewhat less familiar with iRAP and star ratings. But what exactly is the relationship between these two? How should we use these two different tools as practitioners?
Yeah, fantastic question. And our immediate response is you should use them together. I guess one doesn't replace the other. So a road safety audit really mostly draws on the experience and expertise of the auditor. So it's a fantastic process where you get to really, capture the experience and the expertise of the person doing the audit, where they bring their knowledge and their understanding of the local context to the designs. And they also bring their understanding of global best practice on various topics. And also there's no real limit on the scope in terms of detail, at least on a road safety audit. You can get people who are highly skilled in understanding the role of different types of safety barriers and how exactly they should be placed, which is really valuable in the detailed design process. The iRAP approach, on the other hand, is much more focused on the data and an evidence and a systematic approach. It doesn't take the human engineering mind out of the process totally, but it does try to make it very objective, so that we can ensure that every single iRAP assessment that's done produces the same results. In theory, you should get, if you've got two people to do an iRAP assessment at the same road, you get the same result. That's not always the case with a road safety audit, because you do depend a lot on the expertise. The best way to do this, though, is to bring these things together. And we did a nice manual for the Carrick region on how you can put these things together. if you can get a situation where you're doing an iRAP assessment, it's helping to highlight what are the key sections of road where there's high risk, what type of risks are they facing, and then have an auditor focus in on those high risk sections of road and really examine what types of treatments could be used. You can then again use the iRAP tool to measure the impact of the road safety audit recommendations. And so I guess that interactive use of the two tools is where the real value can come from. You can really take an auditor's set of recommendations and measure their impact and make decisions about which ones are most important and which ones will have the biggest benefit.
Excellent, lovely. Now, one of the challenges that we find in many countries is that, and this applies to road safety audit also, that the recommendations that come from iRAP assessments are looking to implement treatments that do not exist within the national road safety standards or infrastructure standards. Now, different countries will respond to that differently, but it does happen sometimes that a country says, "Oh, we cannot do this because it's not within our standards." Have you had experience with that, and how would you advise us to proceed?
Yeah, great question. So yeah, have had lots of experience with that. Sometimes, I mean, it's worth sort of examining that claim in a little detail first, because design standards often do give a little bit of scope to the engineers about what they can and can't do. They rarely say you may not do this sort of treatment if that treatment hasn't been envisaged before. So it's absent from the design standard doesn't necessarily imply that it cannot be done. We have in the Philippines, for example, we recommended the use of pedestrian refuge islands. They hadn't been done before, and the Department of Public Works and Highways was really responsive to that. And they did an executive order to say, here's what they look like, here's what you should build them to. And once that was issued by the secretary, they were able to do them. So they were able to respond on that quite quickly and start to try using those. In China also, we had really interesting experience. That was another case where they were very strongly, rigidly following the design standards. And what the research institute within the ministry did was do like a good practice guide to accompany the iRAP assessments that were happening in the country. And so they said, here are some of the types of treatments that could get identified. Here's some examples of how they've been used worldwide. But here's some examples about how they've been tried in different parts of China as part of experimental projects. So they documented that, and it didn't take the state of a design standard, but because it was a ministry guidance, it gave, I guess, the cover to the engineers at the provincial and local level to do these things, because they could be confident that because it was a ministry document, they were able to try out these things. So it was a little bit of a workaround, but incredibly productive, because it opened the door to all sorts of lower cost treatments being applied really systematically across their network. So yeah, it's definitely a challenge. Also, I think you need to be careful that after one of these assessments, you don't stop the whole thing because one or two of the treatments can't be done. You can always package up the treatments into sort of immediate approach and medium term and longer term. And the medium to longer term ones might include the ones that need some sort of formal documentation to happen before they can proceed. But I think, yeah, the idea, particularly the work that the World Bank has done in demonstration corridors, has been really powerful. If you can sort of frame a project to say, look, this is a trial. We're going to document how it goes, and we're going to follow best practice. That's often a way of getting started on a different type of treatment.
Great. Just coincidentally, even in Sweden, when they started doing their 2+1 roads, the chief executive of the road authority had to sign off because the engineers didn't want to take responsibility for something which many members of the public were saying was going to be a disaster. Turned out to save a lot of lives. Okay. Yep. Michael Anyala, I see you have a question there. Would you like to open your mic?
Hi, Greg.
Hi, Michael.
Hi. Really very useful insights. So, I mean, I think the challenge, obviously, as you know, is how can we accelerate the financing of road safety to achieve this 2030 target? I think it's a big challenge because infrastructure gap is quite huge as you know. So one of the things that we've been thinking is that if we are to do this, we have to really invest in road safety at scale to try and make a difference. Definitely demonstration corridors are useful, but often those will have a limited impact in terms of scale if you want to really have these things up. Now, to try and really scale this up, say at network level, we need the data, the insights, like what you're showing. So the question is, how can we scale up these iRAP assessments to be able to help us with preparing these network level investments? Are there easier ways now to do this that we can do it quickly for countries? Any advice I think on this would be really useful.
Yeah. So I guess you're asking like doing the iRAP assessments at scale to help open this up. Yeah, like really important question. And we're like really conscious that many countries are wanting to find ways to collect this data more cost-effective way and cheaper and faster as well. I guess the first thing to remember is that it's a small percentage of the network that has most of the deaths. So understanding where most travel happens in the first place is really important. We've seen in Vietnam and Thailand, for example, that definitely less than 10%, more like 5% of the network is where most of the travel happens and therefore most of the deaths. And that sometimes is sort of 10,000 kilometers of roads or less. So not massive in terms of as a percentage of the total network that's being managed. So focusing in on firstly where the priority roads are is really important. And then doing these assessments in large scale is really a much more cost-effective way than doing it project by project. So many of the countries that are using the tools are doing it in one block in national network assessment. It gives them data that they can use for 5-10 years. So thousands of kilometers of roads is an initial investment to do it, but that data lasts them a long time. In the longer term, or I guess medium to longer term, we're definitely looking at ways that we can use big data approaches to these. That involves, for example, linking more closely with asset data collection processes, but also whatever other data sources there might be already collected around the roads. We know, for example, that Google Street View has video imagery or good quality imagery of a huge proportion of the road networks around the world. That can be used immediately for doing iRAP assessments. Sometimes it's a little old, but if we can sort of get a sense of what might have happened on the road since then, it's nonetheless really valuable. Tanzania, for example, have just made sure that their asset system, their asset data collection system, has an iRAP plugin that can be used for coding. So they're doing data collection, pavement collection annually. Like they just sort of collect that data without question, and it's something that they do over and over again. That little plugin at least ensures that data can be turned into iRAP data whenever they want to. So you don't have to mobilize special data collection. And it's an interesting thing because I think a road authority will often be happy to collect lots of data about the roughness of their roads and think nothing of that. Whereas collecting data about the safety of their roads is suddenly a concern and an expensive thing. So the more that we can align the data collection for safety with those asset data collection roughness surveys, which happen really regularly, I think the more benefits that we'll get for safety. So yeah, I think my key point is focus in on the roads that really matter. Do it at the scale of one time, take it as a capacity building opportunity locally as well, and align as much as we can with the asset data collection.
Thank you, Greg. I have a couple more questions. One's about investment at scale, and the other is about the currency of data. But firstly, the figures that you showed us about the level of investment that's needed, of course, when you look at it globally over 10 years, it's quite frightening. When you look at it annually for a single country, it looks, quite understandable and acceptable. But still, it's a lot of money, and it's certainly not all going to come from development banks. Can you talk a little bit about alternative or innovative investment options or financing options that might be available?
Yeah, so one particular area that we're exploring a lot, and some countries have made a lot of progress on, is tapping into private finance of roads. So in Brazil, for example, they've put a lot of their public network out to concession operators, partly as a way, I think, of generating cash, but also sort of recognizing that the management of those large road networks is often done better by a company that's set up specifically for that task. So, for example, there's one road network called the Pipa road network in Brazil. It's a concession that's about 1,200 kilometers long. These are not access controlled roads. They're regular rural highways with all sorts of road users using them. As part of the bidding for the process, the government required that the successful bidder would invest heavily in upgrading the roads. So the successful bidder is proposing about $3 billion of investment on this 1,200 kilometres of rural roads. But also really interestingly is the government said, okay, we also want to set in place some performance-based safety targets here. So what they did first was do safety assessments of the whole road network using the iRAP methodology. Then they did safety assessments of what the concession road operator was planning to do. And so there was sort of two baselines. Then they said, all right, let's set some safety targets that progressively ratchet up over the 30-year life of the concessions. So they use the iRAP modeling to say every year in, year out, based on what planning is being, the capital works and maintenance, what's the effect on the star ratings, and what could the targets be to incentivize some sort of action. And the way they incentivized it was to say every concession operator has to give a proportion of the toll back to the government. And they said, each time that you achieve or exceed the star rating target that we've set, and there's different categories, we'll give you a refund back again of those toll revenue. And the reason the government was able to do that is because they genuinely recognize the economic, I guess, imperative of making roads safer. Literally, they're going to have fewer people in hospital beds, fewer people not working, a smaller impact on the community. So that's where they use the concession mechanism to drive road safety and make it a win for the concession operator, a win for the community, and a win for the government as well. So I think there's a lot of potential in that. Like we've seen very much like performance-based maintenance contracts, but performance-based safety contracts is definitely something worthwhile. We can, as you can see from the Safety Insights Explorer, do pretty good estimates of the types of injuries that happen in different contexts and the economic costs of those. Once you have those metrics, you can start to say, okay, these are the sorts of financial, performance payments that could be justified by making sorts of safety improvements on the network.
Excellent, great example, thank you. Now, I wanted to ask you about the currency of data. I note that the data on the numbers of deaths and injuries is based on the 2018 World Health Report, which in turn is based on even older data. So it is 5 to 6 years old. It's exciting to know that the World Health Organization will later this year actually release the updated global status report on road safety. What are your plans to incorporate that data into this tool?
Yeah, we'll put it in right away. So as soon as it's available, we'll put it in. And that will flow through to the health estimates, the injury estimates, but also the business case as well. So as soon as that's ready, we'll put it in there. And we're also thinking there's other opportunities as well. That the global status report includes indicators for each country, for example, about whether road safety audits are required, what are the default speed limits in different countries. And none of that is actually sort of brought to life in any way in the infographics. So yeah, we'll after talking to the WHO, offer to put that into the Safety Insights Explorer as well. So it just becomes a quick reference point for people to look at.
That's terrific. Thank you. Just for people on the call to know, we're also speaking through APRSO to iRAP about incorporating some of this data into the APRSO website for Asia Pacific countries as a group. So Thank you very much, Greg. If there are no other questions, and I do not see any at this point, we will draw to a close. On behalf of participants here, I'd just like to thank you for your time and thank you for the terrific work that iRAP is doing and for this very useful tool. Thank you.
Thanks, Dave. Thanks, everyone.